Hi everyone, my name is Judi Abdelrazik, and today I'll be presenting on bridging the drug discovery gap with AI, empowering global health with DrugAgent. Before we begin, a little about me. I'm a rising senior at the Harker School in San Jose, California, but I'm actually recording this video in Cairo, Egypt, my home country. I'm interested in chemistry, computer science, and biomedical sciences, and I'm currently a research intern at the Stanford Pathology Lab under Dr. Ruben Lowe. I'm the high school volunteer head for Yalla Kafala, a nonprofit, as well as the president for the Middle Eastern Student Association and the director of events operations for the Muslim Student Association. I'm one of the captains for the speech and debate team, and I'm a leader for Link Crew. In my free time, I like to play travel club volleyball. Now let's begin. Millions worldwide lack access to effective treatments, not because cures don't exist, but because they haven't been discovered or repurposed fast enough. Drug discovery takes many years and costs billions because current methods require testing a large number of drug pairs in the lab, which leads to an exponential increase in the number of combinations. This makes research and development especially inaccessible for diseases impacting low and middle income communities. The good news is AI and machine learning tools have started to accelerate and reduce the cost of drug development. They can predict the binding affinity of drug pairs without needing to physically test every combination in the lab. This helps prioritize candidates and reduce experimental costs. However, the problem is that drug interaction models are not accessible for many researchers. I experienced this firsthand during my internship when I spent 2 months trying to find good regeneration conditions for a drug which could have been solved quickly with an AI model. So I asked, what if drug interaction models are as easy to use as a web search? That's what this project is about, making powerful drug target prediction tools usable by non AI experts in global health. My project consists of 4 AI agents. The first agent is a text extraction agent. Researchers submit their proposals or hypotheses in text form, and the agent extracts the protein and drug names. The second agent is the drug target interaction predictor, which passes the protein and drug data to the binding score prediction model using the right parameters. The third agent is the repurposing agent, which suggests FDA approved drug alternatives if they exist. And the final agent is the medical information agent, which provides more details about the drug and the protein. To build a reliable text extraction pipeline, we first evaluated drug and protein name extraction using 2 well-known biomedical datasets: Biocreative BCDR corpus, also known as BC5CDR for drug names, and JNL-PBA for proteins. We then applied filtering using the Chembl database to make sure that we were only evaluating real drug names, removing generic chemical terms that aren't clinically relevant. After that, I did prompt engineering with OpenAI's model, testing several variations and choosing the ones with the highest F1 scores. We found that using shorter hypothesis style input text, like what a researcher might actually type, improved accuracy even more. For drug extraction, we achieved 100% precision and 76% recall, giving us an F1 score of 86%. And for protein extraction, we received 100% precision and 90% recall, which led to an F1 of 95%. Upon manually checking some of the missed drug name predictions, we found that although many of these terms could refer to drugs in general, they were not used as drug names in the specific context of the sentence. The OpenAI API is a context aware model, and thus it extracts only those names that function as drugs given the context of the sentence. For the next agent, the drug target interaction agent, I utilized the deep purpose framework. This framework uses neural networks to help predict the binding score, which is an important parameter for drug design. It embeds both protein and drugs by using different deep learning encoders to generate their deep embeddings, which are then concatenated and passed to a decoder. The decoder is another deep network designed to predict the binding score between the target protein and the drug. I made sure that the model performs correctly by retraining multiple encoder combinations for drug and protein representations. For drug, I used the SMILE sequence and tested two encoders, MPNN, which is a molecular graph, and CNN, a convolutional neural network. For the protein, three encoders were tested: CNN, amino acid composition, also known as AAC, and transformer, which represents the amino acid symbol as a token in order to optimize computational complexity. I validated the models on the Davis and Kiba datasets using the deep purpose framework and split the data. Each dataset was split into 70% training, 10% validation, and 20% testing. Then I calculated the mean square error on test sets, and the data is here. I verified that MPNN AAC achieved the lowest error across both datasets, as well as against Deep TDA, which is the state of the art deep learning method for DTI prediction. This architecture was then used to train the final DTI model on the full binding DB datasets with more than 1 million drug target interactions. The next part of the project focuses on helping researchers beyond just the prediction. The drug repurposing agent looks at a given protein and suggests alternative drugs that might also bind to it, which is crucial in speeding up drug discovery without starting from scratch. It ranks those candidates by how strong the predicted binding is. Then, the medical agent supports this by summarizing how these drugs are used in real life, their clinical purpose, side effects, and any known issues, all using natural language from OpenAI's model. Together, they make it easier for researchers, especially in low resource settings, to explore and validate new ideas with minimal lab access. Now, I'll give a quick demo of DrugAgent. Let's say I hypothesize at how metamorphin inhibits TNF alpha and would like to test my hypothesis. I just type in the protein name, and DrugAgent pulls data from UniPro and predicts drug interactions using deep learning models trained on Davis and Kiba datasets. Here you can see the predicted binding score. I can also get the medical information for both the drug and the protein if I am not very familiar with them. If you click on Repurpose, a ranked list of all the drugs that can potentially bind with the target will appear with their binding scores. Everything is downloadable and easy to share. It's a fast and simple, designed to accelerate biomedical discovery. So, in summary, this project isn't just about machine learning or drug prediction. It's about creating a real impact for communities that are often left out of medical innovation. First, it empowers local researchers with tools that help them explore drug candidates without needing full scale labs. Second, it reduces time and cost of early stage discovery, which is often one of the biggest barriers in drug development. And most importantly, it increases access to powerful research and development tools, especially in low resource settings. The message I want to leave you is this: access to AI tools shouldn't be a privilege, it should be a catalyst for equality. I'd like to thank my family for all their support, the Deep Purpose Framework, the Global Health Leaders Conference at Johns Hopkins University, and you, your listener, for your time. Thank you for listening. I'd love to hear if you have any questions.